Hey guys, it's Hunter again, and I'm here with Aaron.
Hello.
And today is my 2 year on testosterone maniversary. That's what they call it, maniversary. And why do I have the microphone? Because my voice is really scratchy and deep today. I don't know why. If I have a cold or what. And Aaron didn't want to use the microphone. So I'm going to hog the microphone. How do you feel about that?
You go right at it.
Yeah. He can project a little better than me, except for when I'm angry, and then I can really project. I can really project.
Oh yeah.
Can I? So, I want to go over a few things. I don't want to try to keep you too long. Um, Changes after 2 years. Am I done? Am I done yet?
Oh
Cause
no.
yeah, because there's a lot of people that think a person's done after a year, which I have said before, and I don't believe so. I've read online, because everything online is true, right? That after 5 years, you may you may be done. You might be done after 5 years, so hang in there. I think as long as you're on testosterone, you're still going. I think you're still getting gains.
Yes, a lot of people quit testosterone because they're going too far.
Speaking of going too far, okay, so there's a guy on here from Saudi Arabia. If you're watching, you've asked me to help you because you can't get a doctor in Saudi Arabia, and you're trans, female to male, and I'm sorry I cannot help you with that. The only thing I can do is give you advice and tell you please don't take any testosterone because you've not seen a doctor and you're not getting your levels checked. I know you said that you're taking testosterone, you found some, I don't know where you got it. I don't know much about Saudi Arabia except for there's a lot of sand there, and I really don't know anything about what type of doctors you have, if you can even go on hormones legally. I don't know anything about that, and I'm really sorry that I can't mentor you on that. The only advice I can give you is what just to wait it out and either try to get a doctor, an endocrinologist, or get some transgender health care. And if you don't have any of that, wait it out until wherever you're living does have that, or move somewhere different. I don't know where. In Saudi Arabia, I know nothing about it, like I said, and see if you can get some help. Because if you take that testosterone and you don't know how much to take, and you're asking me, I'm not gonna tell you how much to take because I don't know either. I wouldn't take it because it can kill you, ultimately kill you. Anything you want to say about that?
Yes, I think you should get a doctor because if you don't get a doctor, it could be a very early funeral for you. So the thing is you got to get a doctor, and you got to get the right doctor. And you don't beat around the bush with this stuff. You either if you don't have a doctor, don't take it. If you do have a doctor, get the right measurements of what you need.
That's what I said.
Right. So I'm just agreeing.
Okay. All right. So I would give you my other social media info. I don't feel comfortable with that right now. Um, I just ask some other people around your area. I think that would suck though to live somewhere where they just don't allow it, or it's illegal. Like Saudi Arabia might even be illegal. I don't know, but I would hate for that to happen to me. And I just thank God that I can a transition because I would be depressed too. As you said, you are depressed. You're very depressed. Um, I have no other information to give you except for just wait it out. I mean, look, I waited till I was 59. Okay, 59, and that sounds old to a lot of people, or it could be old, and and I waited to get on it. So you can wait. Try to wait. Okay, that's my advice to you. Try to wait. Don't take it. You don't. You're not able to get tested. If you find out you're able to get your blood levels checked and how much to be on, then of course you're going to do it then. But I wouldn't. I wouldn't do it. I wouldn't go black market. So what else? So I really came on here to say Happy Halloween, everybody. And what are my changes after 2 years? Well, let's see. A full 2 years is a long time to be on testosterone. I've been on 100 milligrams most of the time. Um, at one point, my levels were too high, which I've talked about before, so I had to give blood. I gave blood. I donated blood to lower my levels, and it did the trick. It worked. So I went back up to 100 milligrams, and that's what I'm on now. And I tried to give blood recently, and it did not work out for me for the first time in a long time. I'll show you where my armband. See,
It's nice and green.
and you can see my muscles too. You can see my muscles too, right? Yeah, bright green. Um, I don't know what happened, but when the nurse there stuck me, she stuck my vein, and she didn't do it right. Turn around and blame me. For some reason, it was my fault. Like, how could it be my fault? And she said, "Well, I can't get the needle all the way in, and the blood wasn't coming out fast enough. It has to come out a certain rate. I didn't know that before, or they can't take your blood." And so she gets another guy working in there, a guy, and then he shoves it harder. That hurt like hell. I almost screamed or something. You were there.
Yes.
Oh, what did I look like?
You look like somebody was poking you with a knife.
Felt like it. And because the needle's pretty big. I'm not trying to scare you away from donating blood, but I'm telling you, it hurt like hell. So he couldn't even get it in right the second poke, and so he tried a third time, and it hurt like hell. And he thought he got it, and he said, "Yeah, I got it. I think I got it." And then after a while, the blood wasn't coming out. So I only gave like half a bag.
No, you gave 75%.
Was that what they said?
No, I saw the bag. It wasn't.
Oh, and you measured it.
Yes.
Right.
It was very.
Right, he
It
measured
was
it.
almost full.
So I don't know what my T levels are going to be like. When I get tested next week, I have to give my lab results and get poked again. But that doesn't hurt like hell as much as it does to donate blood. It made me feel like I didn't want to donate blood anymore because it hurt that bad.
And what was I doing when they're poking?
Well, he doesn't look because he can't stand needles, so he won't even watch me get poked. Every time I get poked, he turns his head or leaves the
It's a
room.
good thing when I turned my head, there's a TV there.
Yeah. Yeah. So let's go back to changes. Uh, what changes have I had in 2 years? None, absolutely none. Well, if you want to scare yourself, go back to my first video where I just cut my hair. My hair was really long, which really didn't have anything to do with being trans for me, at least. I like long hair. I know I've cut my hair recently, but that's not. To me, I'm just gonna let it grow back out. I like long hair. Just want to see what it looked like short. Now I know. So you can go back to my first video, and the reason I'm doing it with Aaron here is because I did my first video with Aaron, so I thought I'd include him. Isn't that sweet of me?
Yes, absolutely.
And he told me not to use the word sweet because it sounded like a girl. I remember that. I'll never forget that. I told some guy, a pharmacist, he was sweet, and then as we were walking out of the pharmacy, Aaron said, "That's not a guy thing." he always he always tells me what he thinks is a guy thing and what's not a guy thing. So no, I can't use that word sweet. That's sweet.
No, you're allowed to use it that way, but not.
Like you're sweet.
Yes.
No, I'm sorry. It's
You're
gonna.
allowed to say, "Oh, that's sweet." You're allowed to use that, but not.
He knows.
Oh, isn't that sweet?
I didn't say it like that. I didn't go, "Oh, isn't that sweet?" I didn't say it. I go, "Oh, you're sweet." I said it that quick, that fast. I didn't hold out the word
Yes, but
sweet.
you're talking. No, a guy wouldn't tell another guy that he's sweet.
No, I don't. I said that. I didn't say he was sweet. I said that's sweet.
Yes.
Because I thought he gave me some free, what is it, alcohol pads. I thought he gave them to me.
Yes.
I said, "Oh, that's
Sure,
sweet."
knew that that wasn't the case.
And I found out later, no, he just wanted me to pay for him. So Aaron's a cis male, and I think you're done telling me what's a male thing and what's a female thing, right?
Yeah.
Because he's the expert. And don't worry about saying the word sweet, because it's not a guy thing. or a girl thing. I mean, it's not just a girl thing. I'm pretty sure. I'm pretty sure. It's not just for women only. So, what changes have you seen in me since you see me the most?
You want me to answer that one?
No, I just
Okay.
asked it for the hell of it.
You did.
Okay, yeah, because you said something about my attitude every time you're
Yes,
pissed off.
every single time you wake up in the morning, it's like an earthquake.
Well, that's just me in the morning.
Yeah, no, that was you're a little bit more in the morning, if you know what I mean. And right when you go to bed, you're just
Well, so when I'm tired.
when you're tired, you're just so hard.
Okay, that's not how he puts it when he's mad at me. He just knows he's being videotaped, so he's being sweet. He's being really sweet about it.
I'm not being sweet about it.
No,
I'm
and now he gets mad and says, ever since you got on that testosterone, everything's the testosterone. Every
Yes,
argument
yeah.
we have, he blames the testosterone.
Yes.
Yeah. So I'm more aggressive, in other words.
Yes, you're more aggressive. You're more to the point, and I don't know.
And then I get mad and say, you just want me to be a girl. And then you turn around and say, no, I don't.
I just want you to lay off of me. That's what I want.
Okay.
I just want you to lay off. Sometimes I'm going to make a mistake. Let me make my mistakes. Everybody makes mistakes. Lay off.
Calm down.
I'm totally calm.
You should see him. He's constantly grumpy, tired.
Grumpy and tired.
And that's just me defending myself, and so he thinks it's the testosterone. But we've always been like this before testosterone. So
We were never like this before.
I was aggressive before.
You were not.
I was too. When I was mad at you, I would get really defensive and really aggressive. So let's.
Well, ever since you had the tea, less things are flying at my head. I tell you that.
Less things or
Yes.
more things?
Less things. I do.
So then the tea's better.
The tea is better, yes. Because less things are flying at my head when you get moody.
What things flew at your head? Now let's not talk about things like you threw at my head.
I didn't
Okay.
throw anything at your head.
Okay, let's move on. What other things besides aggression? I'm gonna say I have more muscle growth,
Yes, you have more muscle growth.
but that's due to the tea.
Back and on your... all over you have muscle. You can probably pick me up and throw me out the window.
If I was mad enough, I probably could.
Yes.
Um,
And all these people see on the outside will see this guy rolling over, getting thrown out the window.
so aggression. I'm more muscular.
Yes.
What else? I'm hairier.
You're very much hairier.
I'm hairier. I got a lot of hair.
But the main thing is you have to work on your aggression.
No, I'm not working on that.
You need to work on that.
No.
Yes.
I'm not gonna work on being myself. I'm not gonna, I'm just gonna be myself. I'm not gonna
Right.
work on it.
You be yourself.
Then you work on being yourself, or not being yourself, because he's so angry. Half the time I start videotaping him. Then he's real sweet, because he knows I get my phone out and I start videotaping him. Either walks away or he just goes ahead and has his rant and rage. He goes into a rage.
I do not go into a rage.
I have it on videotape. I can show people if you want me to. No, he's not in a rage, but he's really ranting and raving about stuff like on social media that he can't stand. Like, look what Biden's done now, or something. I don't know. Masks, or the way he gets treated in the grocery stores. Some little old ladies, when he goes in to buy clothing, they pick on him, which is wrong, and I don't know why they're picking on him either.
Yes, they made me wear a mask when everybody else wasn't wearing a mask. That I don't understand.
Yeah, so I told him, well, why do you let him pick on you? Just go ahead and tell him off. You don't have to be really aggressive, just be more aggressive. And maybe they'll respect you after that. And he tried it and it worked. Right? You said you went in the next time and they were treating you with kid gloves. or
Yes.
something. Uh huh.
And I don't have to wear a mask anymore.
There you go. You just got to put people in their place, right?
Yes.
I mean, sometimes you have to. But there was one trans guy. I don't watch his channel anymore, but I hadn't started T yet, or I just started it, so I was looking at all these videos, and I was going on these older people, and this one guy was complaining the whole time in his video how uh, some guy humiliated him in public in front of all the neighbors, and kept calling him she during conversations in a circle of friends outside the house or something, and not once did he take that guy to the side or correct his pronouns or say something to him. He just let him beat him up with his words, and he felt so bad about it that he got on YouTube, which he hadn't been on for a long time, just to rant and rave about that. Actually complain and practically cry. And so that wouldn't be something I would do. I would take the person to the side, or hey, let's meet, let's go over here and talk, right? I wouldn't just let him keep calling me she in front of the neighbors. And so what I wrote, I would have hit him. I was just kidding. So the older trans guys, I don't think they like me now, because they probably think, that's very hostile of you. They probably just think I'm hostile because I wouldn't have actually hit him. But I would have taken him to the side, sidebar, right? I mean, you know me. I wouldn't have just let somebody keep calling me she over and over and over.
No.
Uh, I haven't yet, have I?
No.
Okay, so what else changes? mm. Well, lower, below my waist. So the T-dick, I thought that was done growing after about a year. I should have known. It's a year. It's not done growing. Nothing's done. Your gains haven't stopped after a year. But I did notice recently that it's a lot thicker, a lot longer. So I don't know how many inches it is. If it's inches, they say centimeters. But I'm gonna go on from the very base of it to the head. It's a good 3 inches. And I showed this guy here, which I usually don't show. I don't show people. But I thought, I wonder if he thinks it's grown since the first time I showed him. And then what did you have to say? Do you remember?
Yes, it was growing.
That's all you said?
Yes.
No, you didn't. I remember what you said. You said, wow, it's big. I couldn't even see it the first time you showed me. That's what he said. Then I replied, well, you didn't say that the first time I showed you. You said, yeah, well, I see it. It's big. You said that the first time. And now you're saying, I couldn't see it the first time. I couldn't even see you had it.
No, you had it the first time. It's just not as big.
Okay, well then say that like that. Say, yo, it's bigger.
I did say it was bigger.
Right. You go, well, it's big. But it's not.
Well, that's still saying it's bigger.
Well, if it was real big, I wouldn't want lower surgery if it was huge or something. But I still want to get lower surgery. Which I just watched a video of a guy who just had lower surgery because it popped up. And, and he woke up screaming after he had the surgery. And he said screaming, so I'm like, maybe I'll wait on the lower surgery. Because I know that's a lot of pain. And I know you have to really, really be trans and really feel like you're transgender to get surgeries.
Every time you talk about that, I cringe.
Lower surgery?
Yes.
Is that why you cringe? Because
Yes,
of the pain?
because
Oh, because, yeah. Well, you're not having lower...
It's pain. I look through the situation, and it's painful in my head. Just to go through what...
That's because you have a dick.
Well, yeah, and I wouldn't want it chopped off or anything like that.
Well, that's because you're not trans. Well, that's because you're not trans. Trust me.
Yes, I don't know.
But you're really trans, and somebody's really trans. Take them seriously if they are having surgeries, because that's serious.
Very painful.
Nobody wants to go through that. I don't want to go through the pain.
I can't even watch it. It's so painful for me to watch.
Yeah, and then the guy was showing where he had the phalloplasty on his arm, the skin removed off his arm, and it looks so... I just know that was painful.
Just like I can't watch a needle going in.
Well, that's you and needles.
That's painful for me to watch.
Right. Um, so I've had surgeries before, and it's not pretty when you wake up. But I'm sure it's well worth it getting phalloplasty or getting any type of top surgery, lower surgeries. It's well worth it after the pain goes away. All surgeries are,
It's
mostly.
always been with you, right by your side every time you woke up.
Well, I mean, how many surgeries have I had with you?
You had one.
You said every time I woke up, like I had more than one.
But even the second one, I was with you.
Yeah, and I was out of it, right?
Yes.
Is that the one where I thought the nurse was an angel?
Yes.
No, that was before you.
That was before.
I had my gallbladder removed, so that's what we're talking about. Surgeries. I had my gallbladder
But
removed.
I was there with you.
And then I had a surgery after I met Aaron. Actually, right after I met him. Yeah, he was right by my side, feeding me ice chips. I had a hysterectomy, so he was right there by my side, which was really sweet of you.
Sweet.
And men don't say that, right? Sweet. But we do. So what else was I going to talk about? There's a movie. If you have Showtime, or maybe you can get it somewhere else. I don't know where. Stream it or something.
Go on Vumu.
It's called.
Vumu.to.
It's called Beyond the Opposite Sex, and it's about two trans people, one male, one female, middle-aged, and it's an interesting story in their relationships. That's what it's about. I watched it, and the reason I'm advising it because if you don't know what phalloplasty looks like, they showed the trans guy's dick, literally. I was like, because they had him, he was at the doctor's, and he's like, I thought, are they going to show it? Because you can't find it on YouTube. You can't find it anywhere. I can't find what phalloplasty looks like, right? I can't. So you have to go to porn. And even then, I couldn't find that. I could just find what a T-dick looked like. And, so yeah, they show his phallo. And the doctor's like, wow, that's a good 3 inches. And I told Aaron, and he started laughing. Because he didn't watch it with me. He just thought that was funny. And I know why he thought it was funny. Right? Because you thought 3 inches wasn't very much.
Right.
Because he's a cis male, so he's thinking 3 inches. Right? Like, why this guy went through that surgery for 3 inches? I know you were thinking. Well, I'm hoping I get more than 3 inches. I hope I get, 6 to 10. One guy said he had 10 inches and it was just way too big. I told Aaron that and he was laughing his head off. He said, that's not a man. That's not a man thing to say. And I thought, I'm thinking I would have kept that 10 inches. Because he had it downsized. And he really did. He said he had it downsized. Because he didn't want to hurt anybody with it. I'm like, go ahead and hurt somebody with it. You got 10 inches.
And you don't hurt. You don't hurt people. It's actually the bigger the better.
Well, not always for everybody. There's people watching here that don't have a big one, so you know what. I mean, you deal with what you have. Yeah, I'm just saying, if you got a 10-incher, Yeah, you keep it. Why would you downsize it? And then the person he was with, he found out was cheating on him anyway with a cis male. And I told Aaron that, and he was laughing. Like, he said, see, it's because his dick. The woman wanted a real dick or something. I'm like, he downsized for nothing. But, well, I can see if it looked like he had a hard on all the time or was sticking up or something, but I don't know. I'd probably just weigh that puppy down and somehow try to hide it. I wouldn't get it downsized.
You don't even have to hide it.
Well,
you don't have to hide it. Just
brag about it. Wear tighter pants. Yes. Yeah.
And everybody be looking. Look at that.
Look at that little guy with the big dick. Boy, he's got a big schmeckle down there, doesn't he?
Must have big feet.
Yeah, I don't know. He's got little feet. But, I'm hoping that that's what will happen to me, is that doctor might say, do you want to downsize? It's a little too big. I'll be like, oh, hell no, you stay away from it now. I would be like that. Even if I put my pants on, stood up, said, it does look too big, I don't think I'd ask for another surgery, have it downsized. But that's me, right?
Hmm.
I mean, you know me. What do you think I would do? Say, yeah, I think it's too big, or
The thing is if you
I
get
asked
it,
one question.
if you get it,
What do you think I would do?
if you
If it,
get it,
would you stop
you
over?
take you
I
take.
asked you a question.
What would you do?
Yeah, and he thinks I'm aggressive. If you know me, if you were there and the doctor, I had the surgery and the doctor said it's 10 inches. Don't you think it's too big, Hunter? Do you want me to downsize it? What do you think I would say?
You'd say, "Can you add a couple
Oh,
inches?"
yeah, there you go. That's right. That's the right answer. So anyway, what do we get onto that for? Oh, the movie. Watch the movie if you can. Anyway, I saw this guy's phalloplasty, and I was shaking my head too, like, well, that's not big enough. And then he was complaining to the doctor that it wasn't, he can't get erect, and he can't ejaculate inside of his woman. I'm just saying that's what the movie says. That's what he's saying in the movie. It's a documentary style movie. And so I thought, well, maybe they're going to give him an implant, but they didn't. So I didn't understand the purpose of that part of the documentary. Just saying, I can't get my. I can't. What if I can't penetrate? I can't penetrate, so I'm like, oh, I would definitely get the implant. Why didn't this guy get an implant? They didn't even go into that. So when you watch the movie, don't get too excited that this guy's gonna have another operation.
I hate documentaries.
Yeah, well, you can't sit through anything unless it's Star Wars or something.
No, that's not true.
It's true. Has to be action packed.
I sat by The Shining, right through The Shining.
That's kind of boring. That one I find boring. So I don't know how you sat through that.
Because it was a good movie.
Yeah. Oh, any more gangs after 2 years? Voice drop. Somebody wrote on one of my videos, why would you want more of a voice drop? And my voice hadn't even dropped yet in that video. So I'm thinking, lady, that my voice wasn't low in the first place. You better check your hearing.
I think I laughed the hardest at that one.
Because they thought, why would you want your voice to go any lower?
Yes.
I'm like, I can't even sing now, as you can tell. And like, anyway, it's so low, I can't get it to go much higher. And I don't really practice at it, so I'd really have to be practicing every day for the rest of my life to get the. I can hit the note, but it's really low, so it's really difficult. When you go on T, and if you like singing, be prepared. And some people I have seen, they sing perfectly on testosterone. I'm like, I don't know how they're doing it. I just don't know how you guys do it.
They probably do a lot of practicing.
Yeah, but one's like a musical theater. I like his singing too. He does musical theater, and I thought he doesn't sound bad at all. He sounds great. I can't hit those notes like him. And I thought, well, did his voice drop? Maybe his voice hadn't dropped very low, and I heard him talking, and he had a voice drop. It wasn't real low though, not like me, like a baritone. But yeah, he had good control of his vocals.
They need to make a new musical thing called baritone.
Baritone, baritone. Okay, so I think that's all I was going to talk about. Is my anniversary, 2 years, gains, attitudes changed, according to Aaron. I mean, I don't know if it really has or not. I think he just thinks he sees it. Something that's there that's not there.
Yes.
More aggressive. I'm not really aggressive. I can be.
Absolutely.
Oh, and so are you. It's like you got a hold of some of my testosterone or something.
Was that what I took the other day?
Yeah, well, I gave you a shot of. He would be horrible. You would just be awful on, whoops.
I wouldn't be able to handle the needle. I would never take that.
No, even if you were on gel, because you're already a mess. So you're a really angry person.
I'm not an angry person.
He's very tired most of the time. It makes you grumpy. Anything else we were going to talk about? because I don't want to bore anybody anymore.
They're not bored. I'm pretty sure they're
Well,
very
I would sit
excited.
and watch somebody talk for hours, just because I was so interested in transitioning. Learn how to talk, Hunter. Name change. That's what I was going to talk about. So we went to the courthouse. Aaron went with me, and he had a bad attitude. So
I had a
talk about
great attitude.
aggression. I don't want to go with that tonight. I have things to do. Yeah, you were very grumpy, and but I got him to go. You know, and it was $306 just to file to get my name changed and what I want my name changed to. And the woman at the counter was such a fill in the blank.
Bitch.
Okay, don't say that on here, but yeah. Yes. She's sitting way in the back uh, of the office when I go into the office, the clerk. And I said, and I'm standing there, so and I'm waving her to come. I forgot what I even said, but because there was other people sitting around too, and they were standing around, so I didn't want to say, hey, I'm transgendered, I'm changing my name. I didn't want to say that, but she wouldn't come to me. She said, I can hear you from here. And she's sitting in the back of the clerk's office, and she said, well, how can I help you? And she was being real snooty. And so to say, because you're a man, you have privileges or white male privileges, I don't get that because I sure don't. I so far haven't seen it with me. And I sure haven't seen it with Aaron. He gets treated like shit wherever he goes to. So I don't know where you guys get that. Um, put it in the comments below. I'm sure we'll hear from him, right?
Oh, absolutely.
We get white male privileges. No, I don't. I haven't. I actually have not
No such thing as
experienced that so far.
privileges.
Or white woman privileges. I have not experienced that. I had a slew of black friends that we used to discuss this with. Are saying, well, can't you get this and that? You're white. And I have to educate them. It doesn't matter. I can't. Really? We thought because you were white that you'd get that apartment in Beverly Hills. I'm like, no, no. I'm just like you. And that's a whole nother story, right? Because it did not change for me, and I don't know why they just thought things were different for them. And I educated them a little bit, and they were like, that's very educational. Thank you very much. They said we thought because you had blonde hair and blue eyes that I was going to get an apartment in Beverly Hills. I'll never forget that. I said, no, my credit sucks. Are you kidding me? Or it's not good enough. It doesn't really suck. They want me to have owned a house before or a boat or something. And they're like, well, okay, well, we thought because you were white. No. Let me tell you this, the shit that's happened to me in my life. And it's still happening, and I am white, yes. And it still happened. And they were like, this is very interesting. Wow, let's go tell our friends. I'll never forget that. And then my other black friends, this is a whole new story. Yeah, they didn't get treated poorly because they were black. A whole family I used to live with, my best friend at the time. Well, anyway, so we're going off topic here, right?
Yes.
Okay, what were we talking about?
Changes.
All about changes. White male privileges. Okay, if I have them, I don't know that I have them. Because I'm blinded to it. I'm definitely blinded to it.
I don't believe in that.
Especially when Aaron comes back from somewhere by himself and he's complaining how poorly he was treated by people in general. So I'm thinking I think that went out the door a long time ago. White male privileges. It can exist, but I don't know where. Maybe in Saudi Arabia. Maybe somewhere like that. Yeah, I'm just waiting for those white male privileges to come in because I haven't, like I said.
So am I.
I haven't seen it yet. So the clerk was nasty. She didn't want to walk up to the counter.
I've never seen that.
And at this point, she did not know I was trans. I was trans. Sweet trans. She didn't know, and she still treated me poorly. And so she said, well, tell me what you need from there. And she's just sitting on her ass, not looking look like she wasn't doing anything right. That's what Aaron said. Sitting on her fat ass, not even doing anything. So I had to tell her I need a name change. Well, what do you want it changed to? I'm like, could I tell you here in person? I just could not get that woman to come to the counter soon enough, fast enough. Well, I finally got her to come to the counter.
She's still slow getting to the counter.
And then there's people standing around, and she said my dead name really, really loud. Because can you read my writing there? Because I didn't think the pen was working too well as I was, so I thought, like, maybe she'll get the name wrong. She didn't whisper it. She didn't just look at it and say, yes, I can read it. She made sure to read my dead name like she was on speakerphone or something. Really loud, like she announced my dead name, and then she said, you want to change it too? And then she changed it, Hunter, blah, blah, blah. I'm like, I can't believe this woman just did that. And you didn't say anything either. Did you notice it? She said my dead name really loud.
She said both names really loud.
Do you think I wanted her to say my dead name really loud? Okay. That was the whole purpose of me wanting her to come closer too. But either way, I would have wanted her to come up to the counter. I didn't know why she had to sit in the back, way in the back, and say, can I help you? May I help you? See, here my voice is still cracking. I don't know if it's still dropping. So it's 2 years. I could still be getting a voice drop. I don't even know. It still cracks. What else? So, $306, and then I wanted to get a waiver so I didn't have to put my name in the paper, announce it in the paper. So, she had to give me a separate form for that. So, I filled that out. And then I have a court date in November. And that's not to get my name changed. That's just to get it waived so I don't have to present it in the paper. This is the reason I don't want to present my name in the paper, because, like I said before, I have said it before, I don't trust people in this town. I mean, we are living in a little backwards redneck, a little backwards town. It could be worse. I mean, I've seen worse, but I don't want somebody coming to my door wanting to harass me because they read something in the paper. Oh, it was fine. Are you the girl? Which one's the girl? I don't want, anything like that. I have been harassed. I've been jumped, beat up, and this was a long time ago. So it doesn't matter how long ago it was. What matters is it can still happen, and I'm trying to prevent that. And we're going to see what the judge has to say in November. He could say, I don't see a problem here. I don't know why you just don't go ahead and put your name in the paper. And I'm going to say, because it costs probably an extra $150, because you have to put in for 3 weeks. Something happened to the camera here. Hold on. Can you? Okay. So I put down why, because I put down the reason why, and he'll read that, and then he'll ask me something about it. Either he'll say, yes, I'm going to go ahead and waive that. You don't have to put your name in the paper. Let's go ahead with your name change. Let's proceed. Come back another day. Or go ahead, I don't see a problem. Just go ahead and put your name in the paper. I don't think anything bad's going to happen to you. You don't have a good enough reason. In other words, I don't have a restraining order on anybody. I don't have proof that I was beaten up before, because it was in a different state and it was a long time ago. So it really depends on the judge and how he sees it. So I have made steps towards getting my name changed, because I hate seeing my dead name on everything. And I hate getting people knowing that I'm trans. I hate people that I don't know knowing. So that's about it. 2 years. Anything else you want to say before we go?
I have nothing else to say. I think we...
What is that?
That's a cat trying to lay himself.
I think I got some more mustache coming in. You said you thought it looked darker. He says darker. He never says thicker or anything. He just says it's thicker. Darker.
It looks bigger.
Bigger. Yeah, more muscles.
They look
shoulders.
bigger too.
Yeah. I was gonna talk about weight redistribution. I can't even say that word. Here comes one of our cats. Um, yeah, my stomach's a lot hairier and more muscular. The my weight is distributing into my stomach, where you get your typical male pot belly. But it's not a pot belly yet. It's just not. It just looks different. Just looks more masculine. So, would you agree with that?
Yes.
Okay. Because I show him everything, and that's another thing. He says I talk too much about myself. And I said, well, that's because I'm going through changes, and I tend to talk about them a lot. And when I used to have that transgendered girlfriend, because she detransitioned, so I keep saying boyfriend, girlfriend, whatever. That's all that she ever talked about too. I mean, that's mainly what she talked about, and it wasn't even about her changes. It was about her electrolysis, and she talked a lot about trans stuff. And I did get tired of it because it seemed like everything was about her. But now I get it, because when you're transitioning, you're changing, so you tend to want to talk about it. It's new for you. Do you understand it now?
Yes.
Because it's new for me. Like, you're not gonna sit there and talk about how much beard growth you have or the size of your penis, right? You don't talk about that. I
No.
don't think I've ever heard you talk about. You have talked about your beard. You don't like your beard,
No.
and that gets to me that he hates his beard. What? Because I try
Can't
so
stand
damn
it.
hard, like minoxidil and dermarolene, which I quit all that anyway. I don't do any of it now, but I was doing a lot of it, so I'd always ask him, you see any growth, and or sometimes he'd just walk in on me and say, "Wow, I mean, you're really getting a lot of beard growth." No, he doesn't say anything. You don't come in and say, I noticed this is your beard's thicker or your muscles are bigger, but you did say that in the beginning, but you just stopped saying it, and that's okay.
Because because it does still grow, and it does, and both muscles and hair, everything's growing.
Okay. Well, we're growing, and we're gonna grow off this channel right now. Well, thanks for watching. If you want to follow me on Instagram, it's Actors for You. Spell the word actors, and the 4 is the number 4, and it's the letter U. Actors for You. And you can follow me on Instagram. I'd appreciate that. I'll follow you right back. I'm not. I signed up for TikTok, but I'm not on it. I mean, I don't do anything on there yet. Not yet. I do some videos on Instagram.
Yes, you'll have 42 installments on TikTok of this. I think they only allow 1 minute or something as a
Well, I
max,
don't know. Well, I'm still messing around with it.
which means a 42-minute thing would be screwed.
Well, yeah, you can't. I think people are they're switching from YouTube and and they're staying on Instagram, making little short videos. I think that's what people are doing.
Yes.
Because only old people do YouTube, right? Well, I'm gonna go, and happy Halloween, everybody,
Happy
or
Halloween.
happy Hollow weekend. How's that? Happy Halloween, and
Bye.
I'll see you next time. Hunter out. Peace as always.